All right, everybody, thanks for joining. Today we have John Clark on the call on the show today, and we're going to talk about Medicare, how Medicare came about, what the pricing of Medicare is, how you sign up, pretty much everything Medicare that we get from clients' questions. And John, you want to introduce yourself?
My name is John Clark, and I've been doing Medicare since 2006. I started as a captive agent with Mutual of Omaha. Decided to leave the captive position because I wasn't able to offer my clients the numerous products available for Medicare. And started an agency, been selling all the different brands, very versed in Medicare, how it relates to Social Security, because it's all tied together. I thoroughly enjoy helping seniors selecting their Medicare options that are available for them.
Okay. And so why don't we jump in a little bit? I know we get a lot of questions about Medicare. I'm sure your folks, and if you're turning 65, you know more than we do that you get at least 50, 60 different mailers. They try to make it very complicated, but Medicare is super simple to understand. I know there's only four parts, but John, you want to describe what the four parts are?
Sure. So there's a very, very easy way, and I'm going to share with you the easiest way to remember it is there are four parts to Medicare. And if you use a visual of your hand, okay, and you use your thumb as part A, and you think about what hospital you would go to, that would be your part A. That's the hospital side of Medicare. The trigger finger, which would be the Medicare Part B, would be your doctor. And visualize who your doctor is or specialist that would use. So there you have Part A and Part B, which is the hospital and the medical side. Okay. Now I'm going to skip Part C for a second. I'm going to circle back to and I'll explain the reason why. So the ring finger is the Part D, which is very simple, which is the prescription drug plan that you're required to have if you have Part A and Part B. Okay. And we'll get into a greater discussion about explaining how the Part D works. So in 2003, Medicare came out with what they call Advantage plans. Okay. And what it consists of is Part A, Part B, and Part D as a combination. And those are managed by private insurers. Now, those are private insurance health care companies. So what happens is if you consider taking an Advantage plan, you are giving up your original Medicare Part A and Part B. So the last finger, your pinky finger, would be considered, and it's really not a part of Medicare, but I kind of have it laid out that way, would be the Medigap policies, the Medicare supplement policies. And those are designed to fulfill closing the gap on the original Medicare Part A and Part B, where Medicare pays 80%, the Medicare gap would pay the other 20%, making it completely whole.
So I get this question a lot because on the pricing side of it, and I know we'll cover pricing in a second, but on the Advantage plans, a lot of times people ask me, so you don't pay anything for the Advantage plans. How do the insurance companies make any money? So do you want to touch on that?
Sure. So when you're considering an Advantage plan, in particular, in certain states, there are zero premium Advantage plans. Uh, the caveat is that you have to stay within the network that they have. You've got to see their doctors, okay, and utilize their providers, hospitals, clinics, specialists. And by doing that, they can manage your health care. That's why they call it, either an HMO or a PPO. So when I had mentioned previously, you give up your original Medicare and go with a private insurer. What happens is there's a contract arrangement between the Medicare and they pay the private insurance to manage your health care. So currently, the private insurer would receive about $18,000 per person to manage your health care.
In that $18,000, let's say it's a HMO through Humana or whoever, that type of plan.
Mhm.
So Humana would be getting paid $18,000 a year to manage my plan, correct?
Correct.
Okay. But I don't pay anything out of pocket. So it seems like a pretty good deal. But what are the downfalls of that?
Okay, so you wouldn't pay a premium. However, let's say, for instance, on an HMO, a primary doctor visit would be $10 or $5 or zero. Okay, that would be structured in that way. A specialist might be 35 or $50. All the other services will have a fee associated, known as a copay or co-insurance. That's where the out-of-pocket would affect the person, the beneficiary on Medicare. Okay, so there really isn't a free pass on it. Now, in terms of the insurer, the company, if you were a person that never got sick and you only went to the doctor twice a year, well, you're an extremely profitable patient because you have any claims, you didn't charge anything. Now, on the flip side, let's say that you were that particular year, you were going to doctors on a numerous times, and you required a lot of services that maybe exceeded the 18,000. Okay, then you would be costing them. So it's insurance is a balancing act between loss ratio and claims. Keeping you healthy is going to prevent them from having to spend a lot of money.
Okay. So that's why on some of these HMOs, their plans to get you like gym memberships, they throw in a couple of beneficiary. I heard about one giving a Fitbit. Are you familiar with any of
I am
those? Or
familiar with that.
two things with that. One is not everybody's comfortable with the insurance company knowing exactly what their heart rate is 24 hours a day. That being said, but I guess that's all part of their plan, right? Their plan is to make sure that you're getting your steps in, or you're being healthy, you're walking, you're going to the gym. So that prevents them from eating into that 18,000 that they're getting, right?
Well, it's managed healthcare. They want to make sure you remain healthy. If they can keep you healthy and out of the hospital, which is extremely expensive, okay, a visit to the ER room is an average of $3,500. Let's say you're taken by ambulance, add another $800. So now all of a sudden you're at the 4,000 plus. You spend one night in the hospital. Let's say that's 20 grand. Well, now they're upside down.
Right.
So if they keep you healthy and keep you active and on the right diet, watching everything, then you're going to be a great client for them. And
Okay.
it's good for you too, as well as an individual.
Sure. Sure. You're healthy. It's a great
Nobody
way
wants
do
to
it.
get sick.
No. And so the issue there, though, and I get this question too. A lot of the teachers and folks that retire want to travel, right? That's probably 75% of most folks that retire. They've got travel plans. So if they get the HMO style plan here, they get the Advantage plan, and that's suppose they go to Seattle and they're, do their thing. What happens if they fall down or they break a leg, or what happens at that point?
Well, at times it's considered an emergency. So they would have access out of network facilities. However, there's a cost to that. And traditionally, it's about 25% more. So you do get the service, you're just going to pay for having access to that service.
Okay. And the other part too is that what is the max out of pocket? Let's suppose you get the Advantage plan. What is the max out of, and by the way, this is 2021, and I'm sure it varies year to year, but what would be the max out of pocket for that?
All right, very good question. So what will happen is going to vary depending on the carrier. Okay, it can be as low as 3,500, as high as almost 7,500.
Okay.
And that's going to continue. That's a very fluid number. That's going to vacillate
Okay. And that changes year to year. That's not
year to
a,
year and by carrier by carrier.
okay. All right. All right. So if somebody gets into the Advantage plan and they say, oh, you know what, I'd rather be back into the traditional Medigap plans, how do they get back? Or is there a waiting period, or can they even get back?
So a couple of things. That's another good question because it happens a lot. So we have some clients that tried an Advantage plan, maybe didn't like it, and want to go back to original Medicare because they wanted to have a little more flexibility and a little more freedom as to their choice of providers and being able to travel. There is a disenrollment period known as open enrollment that occurs between January and March, where they can go back to original Medicare. And that's the first step they have to do, is get back on original Medicare. Remember now, when they first turned 65 or they left an employer, during a certain period, they're called initial enrollment or guaranteed issue. There are no health questions that are asked. If they're going back from an Advantage plan to original Medicare, they will have to answer underwriting questions in order to be eligible for a supplement.
So in theory, you could sign up for the Advantage plan and then something come up and try to get back on the traditional Medicare plan and not be allowed, right? Because you have to go through underwriting.
That is correct. And it depends on which carrier, because some of them have a 2-year wait period on I call a hiccup. Something happened to you, whether you had a cardio issue or you had a bone density concern, might prevent you from signing up immediately.
And so one of the other things that pops up quite frequently is that we'll have people work past age 65. So I know it's 65, you can sign up for your Part A, which is great. And then you can continue working and continue coverage through, for instance, Palm Beach County through United Healthcare. They just continue their healthcare benefits through the school district. They retire at age 66 or 67, whatever the case is. I know there's a form that they fill out to send into Medicare in order to get enrolled for Part B. A lot of folks think that you don't sign up for Part A and B until after you retire, but that's not the case. You do sign up for Part A when you turn 65, right?
Yes, everybody has to take Part A when you get 65. The Part B is optional at age 65. And you brought up a very good point, because people are working longer. So if they've got an employer plan, you can utilize the employer plan to act as your Part B medical side, but you have to have the Part A.
Okay. All right. And so let's change gears a little bit. Instead of the Advantage plan, let's talk about traditional Medigap plans. So by the way, Medicare is going to cost you how much in 2021?
Well, let me explain what Part A covers and understand how that is broken down. So Part A, you've been paying all these years into Medicare through your payroll deduction. Okay. The value of that, if I was to put a dollar number on it, it's about $438 for your Part A. So you've kind of earned that through your contributions. Okay. The Part B is subsidized, but not to the max. It's going to be based on your income. So depending where you fall on the income scale, if you're $85,000 as a single below and $170,000 as a married couple, then that Part B premium is going to be right now $148.50, I believe.
Okay. And we'll put the chart up. So the interesting thing here is that Medicare, I know, looks back 2 years. So for 2021, it would be looking at what you earned in 2019, correct?
Correct.
And it's banded. Like you said, the first band is 85,000. And on the chart, I know it goes up substantially. I think the highest is around $450 a month or something for high income earners.
I think it's close to 500. And one of the things you've got to be very sensitive to, and this is where Terry could really help you, is because if you elect to take certain assets and it's going to affect your adjusted gross income, you could get hit with that IRMA penalty and put you in a higher Part B premium. So that does make a difference. If you're deciding to take an early withdrawal out of your pension plan, you're going to pay dearly for that on your Medicare.
Okay. Yeah, I just pulled up the chart. It's $504.90 for it. Now, there is a waiver, and I've had clients, let's suppose you were working and in 2019, 2020, you're working, you retire today. There is a waiver, and I don't know the success rate on the waiver, but you can fill it out and say that there's been a life altering. I forget exactly what the statement is on the form, but have you had any clients fill that out and get that waived?
Yes, we offer it to every client that is looking to retire, that is a high earner, because there are 8 exemptions, and one of which is if you're looking to retire like permanently and not work, then that would qualify. If you're moving, got divorced, got married, there are a number of factors that are in there.
Right.
I am told that the approval rate for it is about 99%.
Yeah, I haven't had anybody say that they have not been able to get that. So do you know the specific form number, or we'll try to find
Uh,
that and put it up on the website?
I'll have to get that to you. There is a specific form. It's called the IRMA form. It's an income-related monthly adjustment,
Okay.
uh, Medicare adjustment.
Yeah, this is good to know because a lot of folks don't know this, that you can get that increased premium waived if you fill out that form. And like you say, there's about a 99% chance that they're going to accept it. I mean, how would they argue the fact that you retired and your income went down, that it's not a substantial decrease in your income? So,
Right. You just want to be careful in looking at the whole portfolio of finances that you're not going to trigger it again because they're not going to be forgiving at that point.
so if your retirement income is going to be on one of those bands, may not be advantageous to fill it out, right?
It would require sitting down with you and making sure that you're going to do it correctly.
Okay. All right. All right. We don't want to get anybody in trouble.
Okay.
So what else? Okay, so you're going to sign up, and Medicare, when you sign up for the Part B, is going to run you, again, it's about $150, a little bit less than $150 this year. And it goes up a little bit each year. I think this year it went up by $5 or $6, right? Thereabouts. So it is going to go up a little bit at a time. So whether or not you get the Advantage plan or you get traditional Medicare, Medigap policy, it is still going to cost you the $150 a month, right?
That is correct. There are no exemptions unless you fall below poverty income level to be exempt from paying the Part B.
Okay. So just so everybody knows that you are going to be paying the $150 a month, regardless of what plan you pick, as long as you sign up for Part B, which is another thing too, is that we had one client did not sign up for Part B when he turned 65. And then when he turned, I think it was 69, it's close to 70 years old, he did finally sign up for Part B because he started having some medical issues. You want to talk a little about what happens then and why he got hit with a surcharge?
Sure. So what happens is if you delay your Part B and the delay is a credible reason, for instance, you continue to work, that would be something that Medicare would consider credible coverage. You have to have credible coverage. And in this particular case, this individual may have felt, hey, I don't need it, I'm healthy. Then all of a sudden, he's not feeling too well and he's got to initiate the Part B. Well, Medicare is going to charge you a 10% penalty for not filing correctly and in a timely fashion. Unfortunately, that penalty is lifetime. So you want to definitely be sure that you're aware of the guidelines, the eligibility, the requirements, and not get yourself in a position where you're going to be hit pretty hard financially by the penalty.
Right, and it's 10%. Now, is it 10% of the Part B premium, or what are they charging you a 10% surcharge?
They're going to add the 10% onto your Part B.
Okay.
Okay.
So if it's $150 every year you delay, it's going to be a $15 surcharge, roughly.
Yeah, and remember that's every month.
Right. Yeah. So I mean, it could cost
every month.
Right. And so it could cost you substantially more.
Particularly if it's a lengthy period.
Okay.
10 years would be very expensive.
Yeah, that would cost you a lot of money. So, and again, he just didn't want to sign up for Part B because he didn't want to spend the money, but it ended up paying the surcharge. So it's important to know that at 65, you do want to get this unless you have an employee plan or employer plan, or continue your existing coverage. So the interesting thing about a lot of people that are in the FRS system, and this is just for Florida retirement system, is that they get paid $5 a month for every year that they were working in the system, up to 30 years. So a lot of folks get that extra $5, and if they work 30 years, it's $150 a month. So that helps offset some of these costs as well. The other question I have, or I get quite a bit of as well, is what plan should I get? There's a lot of different plans. It's A, B, C, D, E, F, G. Pick your letter. But what plan suits most people right now today?
Well, right now, the most comprehensive plan would be considered the Plan G. Okay. All insurance have to meet the same benefits in providing what a particular plan offers. So a Plan G would be considered right now the most comprehensive plan available. Then you would have other plans that would offer less benefits, like a Plan N would have some different benefits than a Plan G. And of course, like I said, the Plan G is the top of the tier.
Okay. And we see that in our practice here as well. 99% of people pick Plan G. It was Plan F last year, but and why does Medicare go away from one plan and move to the next? They have too many enrollees, or why does that happen?
So what happened was under the MACRA in 2015, your legislators thought that the Plan F was too rich in benefits because it included the your Part B deductible. Okay, where in the Plan G you have to pay the deductible first, then your benefits kick in. So it was basically a very large pool of people under Plan F that was costing a lot more money to Medicare.
So you say that they're paying the deductible, but what was the deductible under Plan G now that you would not have to pay if it was Plan F?
It's $203.
Okay, so every year, your first $203 that you use of benefit will come out of your pocket. Will come out of a
Exactly. You pay the 203 first.
okay,
Once that's paid, then it pays 100% after that.
right, 100%. And so the other question we get this all the time, is that if somebody travels overseas, which plan covers them when they go overseas?
Okay, first of all, I would always recommend anybody going abroad is to purchase the travel insurance either through their credit card or through their travel agency or cruise. Buy that because Medicare is not going to cover everything. In fact, it's very limited. It's only 20% of $50,000 is the cap. And if you're stuck abroad and you need to be airlifted, you're going to need a charter flight with a pilot, a co-pilot, and an air nurse, plus the fuel of the aircraft and the rental of the aircraft. You're looking at a couple $100,000 that are going to come out of your pocket.
Yeah, I have a buddy that has a pilot's license, and that's what he does for a living, is he airlifts people back to the States for emergencies. Now, you said it's how much of the 50,000? So how much, let's suppose I get sick overseas.
It's a $50,000 cap. That's it.
Cap. Okay.
And it's a 20% deductible that you're going to pay. So what's that, about 10 grand?
Okay. And even if you had any sort of Medicare advantage or any of these other plans, you're going to be out of pocket that money.
Yeah. I mean, realistically, I even buy it domestically when I travel, particularly if I go to Hawaii or Alaska. I buy the extra insurance.
Okay. Just so you know, you can get life flighted back to the States.
Something, but you're in the U.S., you're going to be fine. But I know a lot of people that go to Costa Rica, they go to Mexico.
Sure. I mean, yeah, we have plenty of people that travel all over, whether or not they go to Alaska and take pictures of bears, or whether or not they go on the scattered all across. I mean, not this year, but certainly in years past, people have done a lot of traveling.
Yeah,
it's always good to know. So the result there, or your advice would be to get the travel insurance.
Buy the travel insurance.
And most agencies are going to offer that if you book sort of a package deal anyhow, I would think.
Correct. And sometimes a lot of credit cards offer that as an option as well.
Okay. All right. That's good to know. And let's talk a little about what Medicare does not cover as far as vision and dental. I get a lot of folks, they ask, does Medicare cover my vision and dental? And it's not really for preventive, right? You want to review that?
So original Medicare, when it was created, and you've got to remember, this was done in the 60s. And longevity at that point, when somebody reached 65 or 70, that was considered relatively really old, considering back in the 40s, someone making 60 years of age was almost unheard of. Okay. So fast forward. So when they created original Medicare, it was not part of the program. There is legislation that would add it, but it hasn't gone forward at all. However, in the Advantage plan, they have basic preventive dental and vision with a cap of maybe $1,000 for dental. Some are a little bit richer. Same thing with the vision, where you might be able to go and get a prescription check, get free glasses, but that's about the extent of it.
So what do people do when you get other than just not have coverage, or what are
Well,
the
there's
plans
always
out there?
options, as I always say. Then the option would be to purchase a standalone dental and vision plan. And I will say this, from a personal experience, is because as we get older, don't forget, our eyes are going to change, and our teeth are going to deteriorate, and you might need those taken care of or replaced. So the biggest thing that's happening now are called implants. And those are very, very expensive procedures, not covered by Medicare, not covered under Advantage plans. So you either have to write a check or you have to buy a standalone plan that offers that. And there are plans that are available.
And that would not be considered cosmetic because you're actually
No,
losing your, okay.
no.
So it would be covered under the plan.
Under a standalone plan, yes.
Okay. All right. And they have different thresholds as to how much they would cover, right?
Correct. And it's not, it can vary from 2,500 to $5,000. That would be the full benefit for that year. So if you're having one implant that costs you $4,000, then you've pretty much exhausted almost the $5,000 benefit.
Okay.
So
Yeah, it's no wonder I see people going to Mexico to get implants and all this kind of thing. I mean, I hear about it all the time, but I guess you probably have heard about
it
it as
is less
well.
expensive if you want to travel there. I know a lot of places in Guadalajara, but you know, if
Like
you
I say,
want to
I hear
go,
about it all the time. And people
yeah.
say, "Yeah, I'm going to go to Mexico to get my teeth." But I was like, "Okay, well, I guess."
Well, hey Terry, it's really interesting because one of the plans that I off that is offered allows people to cross over into Tijuana, right, in California, and it's covered. They cover that plan, but just only in that geographic area.
That's funny. Uh, yeah, I went to San Diego State, so I'm familiar with Tijuana. But
There you go.
yeah, it's not sure I'd go down there. Well, yeah, I guess a lot of people do. Any other things that you can think of that clients are running into or issues? I know that before people used to run down Social Security office to get signed up. It was closed for a period of time. What's the easiest way to get started, or how do people get started now?
The easiest way to do it, and I recently had to do it because I became eligible for Medicare, is you go to the Social Security site because that's where it's linked with, okay? But you're not going to be filing for benefit claims, just the Medicare portion. And it's a very, very easy link. I think it's ssa.gov. And all you're going to do is establish an account. The process is once that account is established, you're not going to be able to proceed until you receive a letter from them. Okay. And understand this, Social Security will never call you or text you unless your account is set up. Okay. They're going to receive a security PIN number. And once you have that PIN number, that's the number that you will insert into your app, your process. Then that will allow you to complete the application. Now, once that is done and you're within the eligibility period, they will send a letter out to you verifying who you are, what your effective date is, and what the Medicare ID number of you that you'll be assigned. Okay. So what I always tell everybody, once you file, please open all your mail, because I've had many clients that look at it because they're getting bombarded with mail. They trash it, and that's the letter that they needed. 10 days later, okay, they will get their ID card. It comes in a very generic white envelope, and you want to be able to make sure you open that up. Once you have that, that is the time that you can call Terry and start the enrollment process for Medicare.
Okay. And just as a side note, I do have a client that he was working with Palm Beach County School District, had Part A. He's 66 now, so he needed to sign up for Part B, and he retires at the end of the month, which today is March. But he started this about 6 weeks ago, and he still has not received the letter yet saying that his Part B is active, which is an issue because he can't sign up for Medicare for the Part B, or he can't get a supplement yet. So he's in theory, he could potentially be, because he hasn't got his letter yet, he may not have healthcare coverage for a period of time until he gets that form. Because I know the carriers won't cover you until Medicare says, yeah, this person is enrolled and he has Part B with the active date, which is going to be on your Medicare card.
Correct.
So
So what I'm recommending is don't think that you're going to be able to turn the switch on and go, hey, I'm going to apply for my Medicare a month out because of COVID and the offices that are closed. There is a significant delay in terms of initiating that. So you're probably better off to do it 90 days out. That's the furthest that you can go out is 3 months in advance. So don't wait till the last 30 days that you're deciding to turn on Medicare. You want to be very proactive in getting this done, because if not, you're going to miss the window.
yeah, and what I've been suggesting to clients is on their calendar, most people have birthday calendars, things like that, to mark down 3 months out prior to that, to make sure that they're either calling Medicare, getting the form, or they can get the form on our website. But it's real important that you get signed up sooner than later, because if there were an issue or the mail got lost or any of these kind of things can happen, you'll have to reapply. And if it takes 4 weeks for your first application to figure out that, hey, we didn't get your form or got lost in the mail, you're out, you're cutting it close to not having coverage when it comes time. So and we could do a whole nother one on Social Security, on when to take Social Security, so I'll leave that for another show. But anything else that you think clients should know or that people should know? They can always give us a call come open enrollment, which open enrollment starts when again?
Well, there's a couple, when you turn 65, that's your initial enrollment. Okay, and you're going to have an opportunity. It's a one-time election of not having any underwriting questions asked whatsoever. It also applies when you leave an employer. However, that window is only for 63 days. So don't delay in making and being proactive. Again, I can't stress enough. You want to be proactive. You also want to do business or be assisted by a licensed professional agent that's been in the Medicare arena business for a number of years, that's very versed, that can give you all the options that are available. And the last thing I want to say is, working with an independent agent is probably very beneficial because they can offer you all the products that are available. And I'm not saying that it's not good to deal with a captive agent, but that's all they can offer you.
Yeah, and a captive
So
agent would be somebody that can only represent one particular insurance company.
that is correct. Where an independent can really present you a number of options, choices, and you can select the best one that's going to fit your needs medically and financially.
Yeah. Well, I guess it's a good thing that we're both independent. So
Absolutely.
that's a plus
That's
there,
the
right?
reason why.
Yeah. And one quick follow up to the pricing. So it's interesting. Medicare, from my understanding, gets priced per county. The
Well,
insurance
Medicare,
carrier is going to price out what they're going to charge the client, the end user, whatever the amount it is, but it's going to be based on county by county.
correct. So all plans, supplement plans and advantage plans are all controlled by your residence, by zip code. That's what dictates your premium.
Okay. So, and what are the differences? Like if you were in Martin County versus Miami, is it a big swing? Is it $10? What's the difference there?
It can be significant. I can tell you right now that Dade County is much more money than Martin County, as an example. Palm Beach County could be less money. It could be a little more competitive, depending on the carrier. That's the advantage of, dealing with an independent agent, because they'll be able to tell you exactly XYZ carrier's price versus another XYZ.
Right. And just one final thing is Plan G. If you have 5 different insurance companies offering Plan G, what's the difference in the Plan G? Is there a difference, or what can you get? Or is it regulated by the government? Who dictates what a Plan G covers?
So first of all the premiums have to be approved by the state insurance commission. So the state of Florida is the one that's regulating it. And they can't just arbitrarily, an insurance company arbitrarily go, hey, we're going to have a rate increase because we want it. They have to justify the rate increase. Okay.
Yeah, we
So,
see that, by the way, we see that a lot on long-term care policies. Long-term care policies back in the day were very underpriced. And it seems like every year, I think one of my clients got a notification that's going up 25%. But because of the regulations, they couldn't get you all 25% in one year. It was staggered over a 4-year period.
sorry
Or
about
she could
that.
keep, yeah, thank the government for that. But I mean, the 25% increase is still there. And again, we'll do long-term care on another episode, but
So what the key things to look at is number one is their financial standing. How do they stand financially on paper? Are they A-rated plus? Okay.
okay. And who rates them? S&P, Moody? I mean, who?
S&P,
Okay.
S&P, and then their outlook by Moody. The other thing you want to look at is longevity. How long have they been doing Medicare? Providing, are they brand new to the market? Have they been in the business less than a year? They may be prone to having substantial increases very quickly versus somebody who's been in the business for 50 years.
Okay.
So that's one other thing. The other thing to look at and ask is what's their loss ratio? Now, most people don't know what loss ratio is, but basically what it is what are they paying out in claims? What percentage are they paying out? So sorry, that's a woodpecker that's banging on my telling me that it's time to
Yeah,
go.
well, yeah. Woody Woodpecker out there telling you, okay, it's time to end this. So we got a lot of good information. Again, if you need questions answered, obviously John's wealth of information. I mean, as you can tell, he's 65. You don't look a day over 64, by the way.
You're very generous. Thank you.
So if you got any questions, feel free to give us a call. I'll in the show notes, I'll have our contact information, and also we'll include some of these website links from Medicare and Social Security and so forth and so on. So John, I appreciate your time, and yeah, thank you very much.
Thank you so much, buddy.
All right, thanks.
Look forward to it. Take care.
You should consult a financial advisor familiar with the specific circumstances of your unique financial situation before making any financial decisions. Nothing in this broadcast constitutes a solicitation for the sale or purchase of any securities. Any mentioned rates of return are historical or hypothetical in nature and are not a guarantee of future returns. Terry Martine is an investment advisor representative of FRS Investment Advisors, a Florida investment advisory firm.